You're pregnant with your second. You've gone through all this stuff with you got midwives and a change of pace. Everything's different. So what happened at the end that with your labor, your birth of your baby, what happened?
So it was weird for me because with my first, as I was describing, my water just broke. It was really funny because I felt kind of like off, but I felt like crampy, but wasn't experiencing like real contractions, or at least I didn't think so. And I was just doing my like sixth getting up to pee in the middle of the night. And on one of those, I like went to wipe and was like, oh, there's something off about that. I think it was my mucus plug. And then all of a sudden I started like, there was like this trickling, and I was like, I woke up, my husband was like, I think my water broke. And then I called like the on-call, and there's like the on-call person you talk to first before they put you through the practice, the ones that manage the on-call for like multiple practices. And it was some guy, and he was kind of like, what do you mean you think your water broke? And I was like, I don't know. I think it did. Like, it's just like trickling out of me a little bit, but I don't know if I just like peed my pants a little. And as I'm on the phone with him, it like burst onto the ground. It was like theatrical, like a movie. It was like, which I hear it's not like that. And most of the time, but this was, I had like, and I was like, all right, well, just kidding. It really definitely did. So they did put me through to the OBs who had me come in, but I didn't have labor until I reached the hospital. And then it did pick up on its own. I didn't, and one thing, I'm one of these people, and I know I'm not alone. There's certain, I think, people who, as they're pregnant and in labor, you hear failure to progress, and that was part of it. But I'm one of those people who has contractions, and I think there's a name for this, so feel free to shout it at me if you remember it, because I don't, where you have the contractions pretty close together. They show up, like they're like, oh yeah, you're having a contraction, but they just don't do anything. Like, so I had them, I went from like in both pregnancies, pretty much like no contractions to you're having them a minute and a half apart, but also they're not doing anything. So the first one, I had nothing, and it just went straight into that. Second time with Thomas, with my son, I did have some spaced out contractions, and they were pretty mild. So I was I actually had it a few times like leading up to it, and I had gone back to sleep and been like, well, if I can sleep through them and they go away while I'm sleeping, it's clearly not really labor. So that happened a few times. I slept them off and they stopped. But this night, the night of the 2nd, October 2nd, I kept kind of having them. I couldn't really get comfortable and get to sleep, and I was having like mild contractions. And when I was timing them, they were suddenly like 3 or 4 minutes apart, and they weren't super strong. I was able to kind of talk to the midwife that was on through them and everything like that, which was really awkward because she kept being like, well, I want to talk to you while you're having a contraction. I think she wanted to see if I could. And I was like, you can, and I am, but I'm telling you, I'm having them. I promise you, I know what labor feels like. So I didn't like her really from the get-go, because she kept kind of like being like, I don't know that you need to come in yet. And in my head, I actually did at least have the sense of like, I think I'm supposed to come in pretty early on, because I had a C-section and I need group B strep antibiotics. So I think like, if I'm telling you I'm in labor, I feel like you should just have me come in and get those things. And she was really trying to keep me out of the hospital. So I did not like that midwife at all. I did not like her when I had her at my prenatal appointments. She was just, and I had also had about 3 days prior to this, she had been the one at the hospital when the midwife group had sent me to the hospital to do a non-stress test, because I did just report that I had reduced fetal movement. And I had a great midwife on for that checkup that day. And she was like, you know what, it's probably fine, but I want to send you anyways, just to be sure. Nothing hurts to get a non-stress test and just be on top of it. So she did. And that midwife that was at the hospital kind of acted like she was eye rolly. And then she like ended up ripping off me. She's like, see, you're fine. So I feel like nobody should ever be that way about decreased fetal movements. If someone's coming in, even if it's totally fine, and even if they've just kind of lost track of the fact of like what maybe the change of movements, like don't play around with that. Let people get their non-stress test, and maybe don't be a jerk. But she was. So when I saw that she was on when I got there, I was like, oh, this one. Like, I was so irritated when I called, and I was like, luckily she was like, I'm near the end of my shift. And I was kind of like, bye, like, good. So she was there. Now, I it went bad from the get-go. So I did start getting contractions really close together fairly quickly. And then, so they were like one on top of the other. And there was this nurse who was a visiting nurse to the hospital who went to give me my IV for my antibiotics. She botched something and I had like searing pain all the way out my arms. And she like she ended up blowing a vein. And it was like, and so that was worse pain than the contractions. And I kept being like, but the contractions were still happening. And so I was standing there and I was like, I think I'm going to pass out. And they were like, you won't. And I was like, no, I really just am feeling lightheaded. I think I'm going to pass out. And they were like, no. And then I did. I passed out. I tried to tell them like twice and I had all, the stuff and I hit the floor and my husband like kind of caught me as I was going down and I just woke up. Now, I will say the midwife I did not like walked in and she looked at those nurses and she was like, how did that just happen? She was mad. You could tell. She got me in bed and she was like, how did that just happen? Basically, like she was pretty intense about it. I had to lay in bed for contractions for a little while. So they were like, yeah, maybe we'll figure out this arm situation and get your IV better and, have a few contractions. I tried for a while, I think like 6 or 7 hours where I kind of dealt with those contractions because I thought that I was going to slow down my labor. And they did kind of tell me that like, you don't want to get it too soon. So I didn't get an epidural for a while. I went and tried different things and even the peanut ball. And I know the peanut ball is great, but I really didn't like it. I was like, nope, I hate it. Take it away. I really hated it. And I remember saying they kept saying wow, your contractions are really strong. And I was like, I know. And they were like, they're really close together. And so maybe you're just close to the end. And I was like, okay, well, if I'm really close, like 8 or 9 or more right now, and then I won't get an epidural. But otherwise I want one. And they checked and they were like, you're like 2. And I was like, no, I hate that. Give me an epidural. So I got that. And then my epidural was great. And everything really for a few hours went fine. But then so this was the same trajectory with both of my pregnancies. So I don't know, again, so people in the natural community would immediately be like, that epidural slowed down your labor. I had the same thing with my first baby, that I had contractions one after another, and my body just slowed down. Now I was at so they did decide so the new midwife came in and she said, I would like to give you, so she presented, she said, this is pretty safe. She said, I would like to give you, now she actually didn't ever talk about rupture risk with me, but for the record, she indicated that she had, but she didn't. So she just said, there are some risks with it. She did say that, but she said they're very small and I'm going to do a special amount of Pitocin that it's less than what I would give somebody who does not have a scar on their uterus. So I think she just didn't quite get there. She didn't fully explain, because I was kind of like, okay, cool. What do you mean by that? So what? She just told me, I'm going to give you small increments of Pitocin over a period of time, and they're going to be smaller amounts than I would give somebody who has never had a C-section. So I had Pitocin, and I had been progressing right along when I had my epidural, and this happened actually both times too. In both of my deliveries, one parallel was that once I had my epidural and I was able to, my body, for whatever reason, and maybe it's unrelated, but I actually progressed. I had been stuck at 1 or 2 both times, and I got my epidural and my body, I was progressing. So I got up to 6 both times, and then it just stopped. So at this point I was kind of at 6. So I went from 2 and then 3, 4, 5, 6, and she gave me the Pitocin, and within an hour of the Pitocin, I'd have to look back at my exact times on my notes, I started to feel off. I just started to feel a lot of pressure. I started to feel almost a burning feeling around where my previous incision was, where my scar was. I started to just I can't even describe, my body just didn't feel well all of a sudden. And it wasn't the same as when I had we had choreo and I had the flu. It was my body felt off. His positioning felt off. Everything just felt off. And I felt just tons and tons of pressure. And I felt myself having to breathe through this feeling of intense pressure at that point. And I was just like so for a while, I was just like, I don't feel well. Like, I'm just starting to not feel well. And they were kind of like, well, that can happen throughout labor and in labor, and then it kind of progressed with time to being like, I felt pain beyond just like pressure around my old incision. I started to feel, and it was this very distinctive feeling. And I remember telling them, like, it feels like someone's like cutting me with scissors down there. Like, it feels like someone's just cutting me open. And they were kind of like, well, maybe, the baby is really low and maybe you're just getting close. Like, you're just getting close to delivery. And sometimes breakthrough pain happens with the epidural. Maybe we just need to bolster your epidural. You've had it for a while. And so I kept asking, like, can you check me? Can you check me? And she had checked me like 45 minutes before this. And she was like, I don't want to check you again right now. If I check you too many times, I put you at risk for infection. I don't want to give you another vaginal, like, I don't want to put my hands there anymore than I need to. It ups your risk of infection. So I asked a couple of times, can you just check though? Can you just check that everything's okay? Can you just do a check to see if maybe I've progressed or something? Because I'm like, I just feel off. And those for a long time largely went with nobody listening to me. And then all the while, at this point, it's getting closer to like a little after 5 in the evening. And all of a sudden his heart tracings were starting to get like wacky. They were like all over the place. And then they really dropped. And the nurse came in and just said, well, and it was weird though. I could pick up on nervousness, even though they were trying to come across as not. And they were like, sometimes, I'm just going to reposition you. And they said, sometimes the monitor just moves around and we lose baby's heart rate. Like, we just have to adjust you. And she went to like adjust me and said, like, she just was like, I'm going to go get the midwife to come try. And so the same midwife who came in before and wouldn't check me came in and was like, kind of like white, like I could see it on her face. And I was starting to get nervous now at this point, like, what's wrong? And she was like, I think I just want to check you. And she had just recently told me she was not going to check me. So I'm like, what's going on? Like, and that's when everything just went, like, she went to check. So she lifted, I had a blanket over me and stuff, and I was just not feeling well. And she pulled the blanket, and I remember her just saying like, oh, that's a lot of blood. And then she went in to check me, and she was like, she just said to the nurse, there was a student nurse in the room, and there was 2 others. The one who had just tried to adjust my monitors was still in there, and she was kind of anxiously waiting. And she just said, get Dr. Paivanis. That was get Dr. Paivanis, pull the code bell. She said she ruptured. I can tell she ruptured. And because she had went, and she said, Dr. Paivanis came in. She was like, I want you to check, make sure it's correct. She said, I think there's a complete loss of station and she's bleeding. And so the doctor, like, all of them flipped me. I'd been on my back. They flipped me on all 4s and like put their hand inside of me. And she was just like, yep, we got to go. And like, she's talking to me. The doctor was just talking to me as we were going. They're poking me in both of my arms. They're putting all sorts of stuff in me and putting in oxygen masks over me and like holding. I have no idea exactly what they were doing in there. They were holding some sort of position, but their hand was inside of me the whole time. And they were like running. So there was like a nurse that was on that bed with me as they're moving. And they ended up having to go through all around this nurse's station. All these, the OR that they had prepped was the farthest one away. So as a side note, when they talked to me about things that they had changed after what happened with me, they said that they keep TOLAC patients laboring in the OR right next to the OR versus being so far away. They told me that was one of the things that now if they have TOLAC patients, they put them in the room that's closest to the OR. And they like reserve that for people who are closer to. So apparently that was a Megan change that happened for me, because they were like, every second counts with that, and they had to go quite a bit farther to get to it. So I really just remember there being like this hyper focus all of a sudden where I could it was like everything was going. I had so many people, the code bell going off. I had the anesthesiologist in there and all these people just converging on my room. And so much was happening at once, but I also remember everything slowing down for me. So I remember I've talked about this before. I remember telling someone, one of them dropped a pen and they didn't stop to pick it up. And I remember being like, oh, I remember that being the, not the fact that I was hemorrhaging and that someone's hand was up inside of me and that code bells were going off. It was that moment where I was like, they didn't even stop to pick up their pen. This must be serious. Like they didn't even pick their pen up off the ground. I had such this bizarre thing happening in my head. Like the way your brain processes trauma as it's happening is kind of like, oh, weird. They didn't pick that pen off the ground. I felt just in real time, really just, it was so much happening. I was in so much pain at that point. And then I did just get the sense, I was like, there's something terrible is going to happen. And I just said I remember them getting me on the table, like throwing me onto the table. And there was I remember the surgeon going like this to the anesthesiologist and saying like, can I start? Is she numb? Is she like, and I remember them saying, it's just a little bit longer. I almost have her like just a little longer. And they were like, and she was like, well, I'm gonna have to start if you don't soon. And then they said, the nurse midwife was up on my head and she said, they're gonna just put you under now, Megan. They're just gonna put you under now. And I just said, is my baby dying? Am I dying? And they were like, well, we don't know. And then that's it. That's what they said to me. They were like, we're going to do everything we can, but we don't know. And then that's the last thing I heard. Like everything went black after that. And I woke up. So when I woke up, I had no idea if my baby had survived. I had no idea if he was here. Sorry. When I really had no idea what had happened. They did quickly, tell me that he was alive. They said he's having a hard time though. We have him over here in this other room. So he was with the neonatologist there at that hospital, and they were talking to me. They did come down really quickly and say like, hey, we're going to have to transfer him to Strong, which is the hospital with the level 4 NICU next door. So they did make a point to bring him down in like the little isolate and everything. And they didn't overload me with information too much. I found out later, that he had many minutes where he wasn't breathing, where they had to get his, to completely revive him. And that he had, I think his APGAR scores were, I know they were 0 and 4 to start, 0, 4, 7, I believe. And, so they got him to perk up a bit. They said one of the things that was concerning to them, the nurse had her gloves on and she said, I can't get him to suck on a gloved finger. Like babies just suck. That's what they do. And he won't suck. So she said, we think that he has a brain injury. He was without oxygen for really who knows how long, because, that rupture was in process for a while. And I think some of my anger with it is just that, like, if anyone had listened to me sooner, it might not have needed to get that bad. I did have a total uterine rupture, but the OB who took care of me after said, the good news is it was right along the same ear incision. So she said it was easier for me to repair. She was like, I was able, while we were in there, I cleaned up a little scar tissue for you, which actually I felt a big difference in my recovery. I'd had some nasty scar tissue that caused me some lingering pain with my first pregnancy. So, she said you ruptured all along the whole thing and your baby was completely floating. Like and I actually found out later, like it said on my chart, and I had to ask more questions because it said full uterine rupture and placental abruption. So they didn't really tell me about that much at first. They suspected he had been without oxygen more than 10 minutes, probably closer to 13 or more. And it's really just hard to tell because it's really hard to tell when he really started or when things really started. So they brought a NICU transfer team over from the neighboring hospital. There was a bunch of neonatologists and nurses, and they had the most expensive half-mile ambulance ride ever to take him over to that hospital. And then the neonatologist who was working that night called me and just said, hey, he's not meeting he's not very stable right now. We're having a hard time just keeping him really stable. But she said, he's showing a lot of indicators of HIE right off the bat. And she said, which is hypoxic ischemic encephalopathy, just literally translates to lack of blood flow and oxygen to your brain and vital organs. So she said he's showing signs of that. And she said, really, I want to cool him. I want to do this cooling protocol. And she described what that looked like, the 72 hours. She said in some hospitals, they wear a little cap. Here we put him, just strip him down to a diaper. We put him on this cooling blanket and we lower his core body temperature, to this amount. And I just remember asking, like, are there risks associated? And she said, yes, there are. And babies do have a hard time with it. So even though it's a very, very good treatment, like, it's hard for babies. They just have a hard time. Your body's not supposed to be that temperature. So she said it's a real shock to their system and it causes them discomfort. And so we usually give them like morphine and other things to sedate them and make them comfortable. And so she said, she said, he's not checking all the boxes for cooling, but she said, I really, really think we should do it. And she got my consent. And she said, you have to decide now, because one thing about cooling is it has to start within 6 hours of the injury. So the clock had already been ticking. We are on like hour 3 at this point. So I think to bring that back to, that's something really important that I think sometimes people don't recognize. In the miraculous chance that your baby survives like a home birth transfer and a rupture, which is next to nothing, but say you are truly, I was next door to the hospital. I was literally camping out in their parking lot and I ruptured. The time it takes to assess the baby to be able to make sure they meet the criteria for cooling, and all of that, and then to get that started. And it's not just like, okay, we were deciding on cooling, plop the baby down and cooling started. It's a big undertaking to do that. And the window you have is so tiny, it's so small, 6 hours from the time of the injury to start it. So, and some hospitals don't do it. Like it requires an advanced level of training and care. And there are hospitals not equipped to even do that. It's one of those like level 4 NICU type things. So he did get that. If I look back at his blood lab work that they did, I always laugh because he's got more labs than I think I have my whole life. He just had over 100, like hundreds of them. You could scroll through his chart. They were doing blood, gas, and all sorts of different things constantly. He had a hard time when he was cooled, like she talked about. That doctor is amazing. She stayed on. She was his neonatologist the whole time that he was admitted. And she would explain. So she would do rounds with everyone, and then she would take time to explain. She was like, well, let me put that in like layman's terms for you. Let me explain what I just was rattling off with them. So I actually started to really look forward to rounds every day, because I'd be like, this is where I'm going to get information, and this is where she's going to be helpful for me. I was transferred over to that hospital as well for my postpartum care. I had a vastly different experience being in a non-baby friendly hospital, initiative hospital. I just felt like my care was so much better. And then, this one, he was in the NICU, so I was able to rest because there was not much I could do. So I was able to get some sleep. I was able to take my pain medication. I was able to take care of myself a little bit through my recovery.